annual Medicare Open Enrollment period actually began last month, which means there's still a few more weeks left for seniors to review important changes to their Medicare plans. And joining us with more on what those changes are and what seniors need to know when considering their options, Dr. Eric Kaufman with ABQ Health Partners. Good to have you this morning.
Thanks, glad to be here.
Thanks so much. This is one of those issues that, everybody's kind of right in the thick of that right now, choosing healthcare plans for next year, making sure that their decisions are the correct ones, and seniors included.
Absolutely. This is an important time of the year. It runs through December 7th and opens up on October 15th, as you mentioned before, and it happens every year. And this is the open time where seniors have the opportunity to change their benefit plan. So it's really important that they get involved and get educated.
What do they need to know this year? Are there changes, important changes that they need to keep on a list?
Each and every year there can be changes to the benefit design. So this is specifically for Medicare beneficiaries who choose to go through what's called a Medicare Advantage plan.
Okay.
So it is still a Medicare plan, but it runs through a health plan. And every year they can change the benefits. So it's really important to review the evidence of coverage, review the provider directory, what facilities are there, and also review the formulary to make sure that it matches what they need for their health care.
We're talking about maybe deductible, that kind of thing.
Absolutely.
Those sort of benefits that are included with Medicare.
Yeah, absolutely. Deductibles, what your out-of-pocket is, what facilities you can go to, all those things can change year to year.
Now, is there advice in doing that, in going through that? Is it important to sort of educate yourself maybe with an expert prior to going through the enrollment process?
Yeah, there are lots of ways to get educated. It is important to take the time to do so. So you can get online. There's several resources online, including Medicare.gov. You can go to abqhp.com and get links to where to go for that as well. And then each one of the plans that offers this type of insurance will have information available, as well as seminars and broker events where you can get education.
And when did the enrollment begin?
October 15th.
Okay, and it runs through?
December 7th.
7th of December is what
Correct.
you said. So there's a few more weeks left there. I mean, you don't want to panic yet if you haven't enrolled.
Absolutely.
You still have some time.
Absolutely.
Where can people get more information?
So you can go to Medicare.gov is a good place to go. abqhp.com, you can get a listing of where we have our clinics, which we have 15 primary care locations in town, and we have our staff there that can help you. It's really important at this time of year, too, to distinguish. There's some confusion in the marketplace between the exchange program, which is the ACA piece, and then the Medicare part, which is not part of the ACA. So just remember that there are no major carriers that are exiting the market this year, and there is some confusion around what happened on the exchange products.
You bet. KRQE.com, we're going to link to those websites that you mentioned there a couple of times so that people have good information. Dr. Eric Kaufman with ABQ Health Partners. Thanks for being here.
Thank you.
And we'll be right back. Don't go anywhere.